Good evening and thank you for joining us. Happy Friday, everyone.
Yes.
I'm Mark Hanrahan.
And I'm Tom Sherry. Whitney Ward is off this evening. Well, first up tonight, months after a CREM 2 investigation into safety concerns aboard Durham school buses, they've been fined by the Department of Labor and Industries for violating safety codes. The outbreak among Durham bus drivers and other employees was at its height in February of 2021. One bus attendant died and dozens of others contracted COVID-19.
CREM 2's Morgan Trow has been following this outbreak for 6 months now. She is live in the newsroom tonight with more on this investigation. Morgan?
Mark, Tom, after we learned of the COVID outbreak at Durham, we filed numerous public records requests for emails, videos, and documents to find out what exactly was going on inside the buses. The videos we obtained showed potential safety violations and prompted investigation by Labor and Industries. Now, L&I has concluded in this citation that Durham didn't ensure a safe workplace.
Durham School Services is a company that contracts with Spokane Public Schools, driving thousands of kids to and from their school every day. After months of investigating, the Washington Department of Labor and Industries says Durham School Services did not provide a workplace free from recognized hazards that are causing or are likely to cause serious injury or death. Durham is now facing a $7,000 fine from the state following a COVID-19 outbreak among workers. The Spokane Regional Health District says a COVID outbreak killed 1, infected more than 30, and quarantined more than 60 bus employees in less than 1 month. Last March, CREM filed a public records request to see what was happening on the Durham buses. The tapes show full buses, drivers not always wearing their masks, and other COVID safety violations. Labor and Industries spokesperson says the team was unaware of the bus tapes before our investigation. After our coverage, L&I launched 2 inspections, one focusing on safety and the other on the death of bus attendant Dave Simpson. L&I cites Durham for violating protocols related to social distancing, masking, providing PPE, and reporting COVID hospitalizations and death. The document says that the company did not ensure 6 feet of distance between employees and that employees were wearing face coverings or masks properly, all of which was shown in our tapes. The infraction states employee interviews also determined that staff did not maintain social distance or wear masks properly in the break room. The citation adds that approximately 20 employees would gather in the break room before clocking in with masks below their nose and/or mouths, and employees were also gathering and sitting at tables without maintaining 6 feet of distance. L&I also noted the lack of PPE. The citation says the employer did not ensure to provide PPE at no cost to employees, if the PPE is the type that would reasonably or normally be worn away from the workplace. It shows 2 instances where employees asked for face shields or were required to wear them, but Durham did not provide them. It adds that at least 1 employee had to buy their own equipment and was not reimbursed. Labor and Industries also found that Durham failed to report deaths and inpatient hospitalizations to the Division of Occupational Safety and Health within 8 hours. It adds state regulators determined bus attendant Dave Simpson's death was not reported for a week. They also learned that 3 hospitalized Durham employees were not reported until the next month. Records released to CREM in March show Spokane Public Schools was left in the dark about the outbreak, with emails showing school employees begging for Durham to address the situation with them. SPS later acknowledged reports that safety protocols had not been followed, fining Durham for violations that can no longer be overlooked. SPS gave us a statement that reads, in part, "We expressed our disappointment and concern to company management immediately upon learning about the non-compliance last year. The company responded with a range of corrective actions intended to ensure isolated incidents like these are avoided moving forward." But whether SPS continues to contract with Durham isn't certain. Their statement continues, SPS is entering year 4 of a 5-year contract with Durham. We are now forming a work group to evaluate transportation options and develop a set of recommendations for next steps and the future of our transportation services. Durham confirms they are appealing the fine, a process that can take up to 6 months. We reached out to numerous Durham officials and received a response that reads, in part, "The case referenced happened last year. Since that time, we have made significant management changes." They say there is a new general manager and a new safety supervisor. Neither were available to comment.
But is a $7,000 fine to a large company that operates in more than 30 states adequate? Dave Simpson's family says no, and they are planning to sue Durham for his death. L&I says they calculate penalties by the rate of severity and the probability that an injury or illness occurs. That includes the amount of exposure and the company's track record of health and safety. In the newsroom tonight, Morgan Traub, KREM 2 News.
Morgan, thank you very much. A firefighter with Spokane County Fire District 9 died while fighting a brush fire yesterday. Cody Traber was an 18-year veteran of District 9. He'd previously served in Stevens County Fire District 1, Cheney Fire Department, and the Department of Natural Resources Arcadia District. The incident occurred at around 10 p.m. on Thursday. We'll have more on Traber's life and legacy coming up on KREM 2 News at 10 and 11 o'clock tonight.
And the Panhandle Health District is issuing a health advisory for the Priest Lake Outlet and Chuck Slough. Now, this is due to the presence of blue-green algae. The advisory applies to the Priest Lake Outlet from Outlet Bay Road to the dam and Chuck Slough west of Sandpoint. And you can see both of those areas circled in red on your screen. People are asked to be careful in or near the water.
All right, Tom, we made it to the weekend. Let's talk weather. We had a little bit of rain today, but it seems like it's moved out. And the weekend forecast, my goodness, looks about perfect.
Yeah, the coolest day was today with low 70s, and we're looking for 80s over the weekend. And I love this. The air quality is good. This time yesterday, we had moderate air quality. Take a look at the current temperature, 73 degrees. Wind is out of the west at 12 miles an hour. You're actually going to see decreasing clouds in the overnight hours as some of these showers and the cloud covers move off to the east of us. So we'll call for sunshine on Saturday and a high of 79, 83 the expected high on Sunday. I'll check your 10-day outlook coming up in just about 10 minutes.
Looks pretty good. All right, some disturbing news now from the Panhandle Health District.
Yeah, the daily COVID case numbers they are reporting are probably much smaller than the real number of positive tests. Our Casey Decker joins us live in the newsroom to explain why. Casey.
Well, Tom, Mark, like so many other organizations, the Panhandle Health District is suffering from a staffing shortage. And with the Delta variant causing a record-breaking surge of the coronavirus, there's now a huge backlog. Normally, when positive tests get reported to the health district, staffers will then reach out to the patients. They'll give them advice on how to properly quarantine and collect more information. Sometimes they'll initiate contact tracing, but that's become more infrequent as community spread has skyrocketed. Then they input the information they've collected into the data system, and that system is used to report daily new case numbers. But right now, there just aren't enough employees to keep up with all the new positive tests, make the calls, and enter the data. Some days the backlog nears 1,000 positive tests, and Panhandle Health says that for weeks now, many of the new daily case numbers we've been getting could be less than half of the actual numbers. One exacerbating factor in all this was the demobilization of the National Guard. I'm told that when that happened, the caseload at the time was actually relatively low and it didn't cause too much stress on the system, but now that's a significant source of labor lost, leaving us in a frightening place of looking at bad numbers and knowing that in actuality, they're probably even worse. Mark, Tom.
All right, Casey, thank you very much. Well, as North Idaho struggles with a surge of COVID patients and hospitalizations, Kootenai Health today started giving the first doses of the monoclonal antibody treatments to sick patients.
So yesterday, Governor Little announced that 3 antibody treatment facilities, including one at Kootenai Health. The goal was to keep even more patients out of the already overwhelmed hospitals.
So how do those treatments work and who are they for? Well, today I interviewed Kelly Griffith to get some answers. She's the Executive Director of Regional Pharmacy Services at Kootenai Health, and she explains the monoclonal antibodies are synthetic antibodies that support what your body would normally make when you're exposed to any kind of a virus. The treatments are given via injection and are generally for patients who are COVID positive with mild to moderate symptoms with a risk factor for developing serious disease. Griffith explains the treatment's effectiveness.
In people that are sick, that are already sick but have mild disease with risk factors, showed a 70% reduction in progression into hospitalization or death. And then in people who have had a significant exposure but aren't yet sick, it showed a 80% reduction in progression to disease, both studies within 30 days.
Griffith says the treatments are free for the time being. They have enough supply to administer about 100 treatments per week. The treatment center at Kootenai Health is located on the main health campus in the main health resource center building. Griffith, by the way, wanted to be clear the vaccine is still by far the best way to avoid becoming seriously sick from COVID and to maintain immunity. She says while the antibody treatments work well, immunity from those treatments only lasts about a month.
Well, the North Idaho College Board of Trustees has voted to rescind the college's mask mandate. Their decision comes the same week that Kootenai Health broke their record for the highest number of coronavirus patients. The NIC president announced that the mandate last week that required students, staff, and visitors to wear double-layer face coverings while in class with other students, well, that mandate went into effect on Monday, but during a special meeting Thursday afternoon, the board voted 3-2 in favor of doing away with that mandate. Taking a look now at today's latest coronavirus numbers here in Spokane, the number of new reported cases today is 404. And right now there are 210 coronavirus patients hospitalized in Spokane. About 58% of the eligible Spokane County population has been vaccinated, and about 52% of people in Spokane County now are fully vaccinated.
All right, thousands of supplies are getting packed up today for the Krem Cares Tools to Schools drive. Coming up after the break, the latest on those fundraising efforts. We're back after a quick break.